So, you were saying that there's great things happening in Tulsa. Tulsa was also one of the 31 tech hubs selected by the U.S. Department of Commerce Economic Development Administration as part of a $500 million investment in strengthening economic and national security. So I understand you're doing some interesting work with technology. Can you tell us a little bit more about that?
Yeah, so being designated a tech hub definitely supercharges, I think is a word that's been used, that industry. And so we've been doing some stuff with Unmanned Air Systems, or UAS, and robotics for a number of years in Tulsa. But since we started kind of growing some of our co-response programs, we have implemented in that technology with some of those programs too, like drones or unmanned air systems, to improve situational awareness on some of this crisis response that we see in the city. And so we've had these programs in place for a little while. So now we've had this ability to test some of these things out. And what we've found is that through this, we have improved situational awareness. We have found out things that weren't necessarily accurate while being on scenes that has improved the safety of our first responders and our mental health professionals on scene, and also helped to ensure that that situation was mitigated safely for everybody involved. I'm going to keep going back to this because I think it's prevalent, and it also improves first responder mental health wellness. This is tough work, and so being designated a tech hub has really, like I said, supercharged our ability to develop and innovate. And so lots more stuff on the horizon in regards to our capabilities, but in regards to crisis response.
Yeah, how does that, obviously situational awareness, but what other ways can it be used?
I can give an example of that. So as a mental health professional, thinking of where this technology comes in and what do we do with that in a crisis situation, we think about de-escalation, and we use our voices and we use our mannerisms, but how do we use technology for de-escalation? One such situation would be when a drone was used to be able to look in a window and be able to see that someone was safe, to be able to de-escalate the situation of family members that have arrived on scene. So the situation was very escalated. Our first responders are there, our mental health professionals are there, but by the utilization of a drone, just to be able to see that the individual wasn't in the type of crisis that it had presented itself to us at that time, gave us that time to be able to de-escalate and put some distance between that situation.
And I'm sure there's the safety component of all this too.
Yes, when I think about the person up on the tower, the fire department had a drone up, and it was at a distance, but you could still see. And what that allows us to do is to get a look at the person, 360, to see if there's a gun in the waistband, if there's some kind of threat like that, because we really were evaluating at that time, is this person a threat to the community or just themselves, if we had to do a tactical disengagement and leave. So that the drone allowed us to do that. And I was on scene. I was able to see that footage, and it was really great. Now, the police department has body cams, and I think that allows us to we review calls, we train from those calls, so it's been very helpful for us using that technology. And of course, Chief Franklin really brought our department along a lot in technology, and right now, of course, we're discussing having police drones. I also want to make sure that we talk about the Hardesty Family Foundation and how they, from the very beginning, stood beside us to make sure that these programs, started. They donated a vehicle. The CRT vehicle was donated.
It's beautiful too, and I know that's made such a difference, not only with recognizing the CRT, but because you were before in a paramedic vehicle, weren't you? Yeah, and just having more of a community awareness about the services and what this is and who these people are and why are they all together, and it changes the public perception.
This coming up year in September, we will have Co-Responder Week again. And what we really want to do is raise awareness about what these teams are doing. We want to engage within the community. We're going to have a lot of great events coming up for that. where these teams, these crews are going to be out there and engaging and having conversations about what we're doing. I think it's a great opportunity for the community to learn more about these teams, as well as us to have meaningful conversations with the community about needs and where we're at. Because, Tulsa, we have a really great community. I mean, we really do. Very supportive, or we wouldn't be here today. When you talk about the heart of Seas, you talk about Tulsa Area United Way, and these great and mental health associate and family and children's services, all these great community partners and resources coming together to tackle a specific cause. And it really does take a village. And I think we're very fortunate, and not that we're a finished product by any means, or we were where we want to be, but we do feel like we're moving in that direction. So I would encourage that co-responder of the week this year for anyone to come out and talk with these teams, talk with these great people.
So there are just so many partners that are instrumental in the founding of the community response team.
There really are. There were so many people who helped us in the beginning when this vision was coming to light in Tulsa, and how do we make it a reality? Another one of those groups were the Graves. I know that he was a ex-Tulsa police officer.
John Graves.
Yes. So he really had that vision to be able to see what we were doing, and had a passion to help us out as well.
Yeah, John and Sarah have been real advocates for family and children's services and understanding deep community needs. And the Zero Family Foundations were also key in getting this collaboration going. This program would not have been possible without all of those individuals.
We talk about the co-response models at the right resources at the right time, every time. But when you look at the agencies themselves, it applies. We had the right leadership at the right time to make this happen.
Absolutely. So what's next for the community response co-responder model in Tulsa?
I think right now, we're in discussions on improving that process from the time that call comes in immediately. So how can we really, because that's really for crisis response or mental health 911 response, that's kind of where it starts, is in the dispatch center. And so how can we start that process quickly, get the right people there, and keep other resources where they need to be? I think that's a big area that we're looking at improving or evolving as we move forward, as well as continuing to kind of track what we're doing so we can improve outcomes. I think we're always looking to find how we can improve. And it starts with data and having the right information, and then sharing and tracking that so we can all improve.
What we're doing right now is working with Healthy Minds through our First Responder Advisory Council on the crisis system as a whole. We've been looking at LA County's model and kind of adapting that to Tulsa, and we're doing a lot of mapping, system mapping. And I know that our 911 director has been working with Amanda over here, so she can talk about the changing of the protocols.
Yeah, I'm really excited actually about being able to work with them in the 911 center. We have clinicians through all of this. One of those lessons learned is we really realized that having someone that can be almost like an air traffic controller for all of these different co-responder models is important to make sure that the right team is on the right call and that we're using our resources to our best abilities. And so through this project, we're really looking at what having the clinician in there and helping with this mapping of the 911 calls that come in, and then making sure it's dispatched at the correct team level is going to be put in place.